Today, I would like to talk to you about something that's really interesting that happens to us after weight loss surgery: changes in different hormone levels. Those of us who are obese have often a lot of hormones that or a higher level of hormones that are not good and lower level of hormones that we need. So let's talk about what happens after weight loss surgery on a cellular hormonal level. I am sure that you have heard of people, women, who have increased fertility after weight loss surgery. A lot of women who have had irregular periods, who have not ovulated on a regular basis after weight loss surgery, boom, start having periods, start ovulating, and end up pregnant. A lot of women actually get weight loss surgery to boost their fertility. So, why does that happen? After weight loss surgery, one thing or some things that change in women are FSH, which is follicular stimulating hormone, and LH, which is luteinizing hormone, levels go up. That leads to increased ovulation, which leads to increased fertility. Another thing that happens in women in hormonal level is a decrease in testosterone, specifically androgen. That is what is very commonly elevated in polycystic ovarian disease. That can cause that middle obesity, that abdominal obesity. It can cause increase in facial hair. It can cause decrease in fertility. After weight loss surgery, those levels have been shown to decrease. Estrogen levels have been shown to increase. Here again, increase in fertility. In men, the exact opposite is true. Testosterone levels go up, estrogen levels tend to go down. A lot of people ask me, well, yeah, but is that due to the weight loss or is that due to the surgery? If I lost 100 pounds, 150 pounds, whatever, with weight loss surgery, following weight loss surgery, if I lost that same amount of weight, would those levels drop as much? Interesting. There have been several studies that have looked at that and have found that the hormones, several of the hormones that are changed by weight loss surgery, the change happens immediately after surgery before significant weight loss can take place. So, it's not just related to the weight loss. One thing in particular, another hormone in particular, that this has been found true is insulin levels. When you are pre diabetic, and a lot of obese people are, what happens is your insulin, your tissues get desensitized to insulin. Glucose is what your tissues and your cells need to feed on to function. Insulin is the key that gets that glucose into your tissues. As in obese people, in many obese people, what happens is those tissues get desensitized to the insulin. So you produce more insulin to get the same effect of getting that glucose in the cells. Eventually, your body can't keep up with that insulin production, that increased amount of insulin that is required to have the same effect to feed your tissues. So that's when diabetes happens. After weight loss surgery, within days after weight loss surgery, studies have shown insulin levels decrease. Your tissues don't need as much insulin to let in that glucose. That is groundbreaking. That is amazing. And that's clearly tied to the GI mechanism of your weight loss surgery. Either the bypass or the gastric sleeve, the part of the stomach that's removed. A lot of the studies look at the nutrients hitting your lower uh, colon, your the different area of your intestines sooner, and that has an effect on those hormone levels. One big one that everybody hears about is GLP-1 hormone. GLP-1 hormone is the primary mechanism in the new weight loss drugs, in Wegovy, in Mounjaro, in Zepbound, in Ozempic, all those things that we hear about. After weight loss surgery, here again, research has shown GLP levels go up. So, those of us who have had weight loss surgery get some of the effect of those injectable drugs that are hundreds of dollars a month from the surgery. That GLP level increase causes decreased hunger, increased satiety, as well as increased glucose sensitivity that we just talked about. The estrogen level going up after weight loss surgery in women has many effects. Besides fertility, increases your bone health. Women who some of us know, women who go through menopause early or who take drugs such as Depo-Provera to decrease or suppress ovulation have increased risk of osteoporosis. That's due to that estrogen level. The estrogen level going up to not a high level, but a normal level for our age is protective of our bones. So that's a big deal. So, overall, folks, not only do you have all of the wonderful effects of weight loss, increased control of your blood pressure, decrease in diabetes, decrease in joint pain, just increase in activity level, all of those things. Weight loss surgery has been proven to make significant changes in hormone levels independent of the weight loss. So, good to know. I would love to hear any feedback, any questions that you have. I would also love to hear any suggestions for future videos. This was a suggestion that a viewer made wanting me to talk about specifically GLP-1, but also other hormones as well. I hope that this video has been helpful to you. I hope everybody has a great week here in the U.S. We've got Labor Day coming up, so hopefully everybody will get an extra day off. Here's a preview for next week. Next week I will be 6 months post-op from my plastic surgery. I had an extended tummy tuck and an arm lift with chest wall extension. I'm going to update you on my progress with that, on the results, any problems I've had, any plans for the future. Have a great week, everybody. We'll see you next Wednesday. Bye.